The health experts have called for deliberate efforts to invest more on women, children, and adolescent health to reduce increased rates of maternal child mortality at all levels. This formed part of the discussion at a virtual meeting to mark this year's event series with the 77th World Health Assembly, WHA. The panelists submitted that with just 6 years left to the 2030 SDG deadline, 80% of countries are currently off track in reaching the SDG maternal mortality target, while 20% of countries are off track in reducing under 5 mortality. The event, which is co-hosted by the government of South Africa, WHO, and co-organized by PMNCH with support from UNICEF as well as UNFPA, was tagged Galvanizing Political Leadership for Maternal, Newborn and Child, MNCH, with focus on the proposed WHA Resolution 11.7. During the panel session, some of the African leaders, including Honorable Dr. Austin Dembi, Minister of Health and Sanitation, Sierra Leone, Honorable Dr. Ali Haji Adam, Minister of Health, Federal Republic of Somalia, said 63 countries are off course in meeting the 2030 SDG target for newborn mortality and 54 countries similarly in meeting the under 5 child mortality target, hence the need for urgent attention to save lives. More so, Honorable Dr. Samantha Lal Sen, Minister of Health and Family Welfare, Bangladesh, and Honorable Kumbize Kandodo Chiponda, Minister of Health and Population, Malawi, agreed that political leadership is needed to refocus the world's attention on the importance of maternal, newborn, and child health.
If we improve our immunization programs, access to the basic health,
we have to teach our ladies to go to the hospital, which is very important.
We must start to look at how else do we make sure that the postnatal follow-up care is up to date.
We believe that as we address these things, we're addressing quality, looking at nutrition, looking at health, looking at vaccination, looking at social circumstances.
In order to ensure proper protection, legal frameworks that are going to protect the rights of the woman, empower the woman.
Contributing Global Director Health and Nutrition, Save the Children International, Dr. Revita Palki, Assistant Director, Universal Health Coverage, Dr. Bruce Ayiward, and Executive Director, UNICEF, Ted Chaiban, emphasized on using the legal framework to ensure governments implement the WHO resolution on MNCH.
CSOs and NGOs' contributions to the development and capacitating of community health workers, I think they are very key in making sure that the services are reaching.
We're going to launch a new new strategy for global health. And that strategy is anchored in 6 big strategic objectives. It's advancing the agenda on maternal, child, newborn, adolescent health. We need most. So 5 things. The political leadership, which is what this event is all about. Galvanizing, keeping it. The second thing we need, Chris spoke to it, prioritizing what works.
Focusing on areas and investments where needs are greatest. And for UNICEF, that means focusing on the regions and the countries where the burdens of child and maternal mortality are highest.
The Executive Director, PMNCH, Rajat Kholsa, said this year's World Health Assembly, WHO, spotlights the faltering progress in achieving the Sustainable Development Goals for women, children, and adolescents in Africa. Added that galvanizing political will in increasing investments on women and children health remains imperative.
My own personal story is invest in women.